Hello and namaste, guys. Welcome to a brand new episode of the Dr. Anushruti show. Today on board, we have someone who is a renowned and honored personality in the field of physiotherapy. He is the chairperson, International Affairs of the Indian Association of Physiotherapists. He is someone who was always looked upon when the word physiotherapy is being taken. And you all would agree with one fact that a single conversation with some persons does not feel enough. So let's all together welcome once again the honored and the most celebrated people from this fraternity, Dr. Ali Irani ji. Namaste, sir. How are you?
Good afternoon and namaskar to all of you.
We are so proud to have you on board with us because not just one time, but again, and it really makes me feel that even you had this urge to talk to my audience and me on this burning issue that is the struggles of physiotherapists in this today's era.
Why struggle?
Because we have seen a lot of people actually giving me questions for you because when you were about to come over here we ran a promo of you that you are coming soon on our on our channel, and people had this question that he is the only one who can answer, so you are that one person people look upon you.
Okay, sounds good. Start.
Okay. Well, sir, in today's era, you would have seen a lot of people, a lot of physiotherapists changing their profession. Also, those who are into the profession, what they do is they try to acquire new skills. New skills as in cupping therapy, hijama therapy, chiro practicing. What do you feel? Why is our well-designed 4.5 years of course does not feel enough for them? Or do you feel that a good physiotherapist, the best physiotherapist, should actually acquire all these skills by paying so much to a different type of doctor to actually attain the title of good physiotherapist? What do you feel? So, why is it happening? And do you feel this is the right thing to happen?
See, as far as learning new techniques are concerned, just sorry, around maybe 3 months back, I went and did a course on manual therapy, osteopathy. Okay, so learning never stops. Let me take you back. There was a course called MBBS,
Yeah.
which is still there. So it was what? It was Bachelor in Medicine and Bachelor in Surgery. And after finishing that, they used to do everything possible. Then came something called specialization. So the specialization went into being a medic physician or surgery. Then surgery got subdivided into which surgery? Orthopedic surgery, neurosurgery, pediatric surgery. Again, orthopedic went into spine, knee joint, shoulder, ankle. We have got only somebody who is looking at ankle, somebody is only looking at hand. Super specialist. Physicians got subdivided into general medicine, neurology, pediatrician, urologist, neurologist. All this thing came. So with time, people want to be specifically specialist. So I feel 4.5 years finishing physiotherapy to open a physiotherapy department is fine. But if you want to improve your skill, then people in MPT take musculoskeletal, orthopedic, sports medicine, neuro. Neuro is subdivided into pediatric neuro and adult neuro. Then in our university, we even have brain mapping. So we are using EEG. So similarly, in cardio, so somebody only wants chest, somebody only wants to be in the rehab of cardiac rehab. So many things. So why not? When you go to a restaurant and when you see a buffet, you will feel like seeing what you want to have. So if you know your specialist, your physios can do dry needling, can do taping, can do manual therapy, can do osteopathy. What is wrong? It's part and parcel. So to redefine physiotherapy, we are into movement disorders. So anything that has to do with movement, if you can improve the movement of the patient, the strength of the patient, so it comes under our field. We are not giving medication. We don't give medicines. So as
Yes.
far as we are going to use water therapy, aquatherapy is coming up. We are going to use water. We are going to use air. We are going to use electricity for all our modalities. There's nothing wrong. So we should be an all-rounder. We should be able to know what will help our patient the best. So there's nothing wrong. Those who change, yes, but many who after doing physiotherapy go for MBA, they would do MBA in hospital administration. Nothing wrong. Maybe they would like more of administration work. And we have physios who only love teaching. So they do their PhD also in a particular subject. They like to teach. Somebody don't like teaching. I've got students who have done the PhD also, but they want to be a clinician. They want to only see patient, treat patient. So it is your call what you want to be after doing physiotherapy. You can open up a clinic and call yourself a physiotherapist and see all type of patient. You can see a neuro, you can see an ortho, and you can see a sports patient.
So
Yes.
if this is not wrong, keeping in mind what you said, why is these things are not included in our curriculum? Why some of them can learn who can afford to learn? Because you would agree with one fact that in the name of learning, people charge hefty amount of this. Many of the students cannot really afford. So if this is not wrong, if this is one thing that makes specialization or that adds sparkles to one's personality as a physiotherapist, why should not these things be included in the curriculum of our 4.5 years of course?
So this workshops done by some of the people,
Yeah.
they live on that. They don't have clinic. But you call me anything that I know, and I go to any college or any conference anywhere, I don't charge. For me, teaching is learning.
That is why you are Dr. Ali Irani. This is what the
I
difference is.
will I'll go to teach.
Yeah.
I'm not going to charge. For me, it's not good if I'm going to charge a student. So I make it a point wherever I go, I inform the students also, okay, I have not charged. So if you have been charged, you can ask a question. So sometimes they charge for the, what do you say, breakfast or lunch that they are serving. So it doesn't involve me. Maybe the institute doesn't want to pay for that. So they will take from the student. I don't mind. But to that they have paid me to come is wrong.
Is
I
absolute.
don't charge. It's known. It's now 37 years I'm practicing. July will be 38 years. So I love to go wherever I'm called, if time permits. I was 2 weeks back in Uzbekistan, Tashkent, and definitely I want to go and put up a college of physiotherapy also there. I want to start physiotherapy there because the country doesn't have experts on physiotherapy. They also human beings. They also need physiotherapy. Almost 70% of India is in rural area, 30% are urban. So don't you think rural also needs physiotherapy?
It definitely needs one.
Thank God, IAP is doing a great work of having a chapter of physiotherapy or branch in every district of India. We were states first, then big cities came. Now even the smaller places have a branch of physiotherapy, IAP. So this is whole idea is to we have to take it to the places. Please remember, when I was a student, there were only 7 physiotherapy colleges, and it was a 2 years diploma course. I went to Baroda to do a degree course. MS University was the only university giving degree. Rest of the 6 colleges were giving diploma.
Mm-hmm.
From that 2 years course, we became 3.5 years, 4.5 years. Now we are already thinking of making it a 5 year course. Then MPT is 2 years and another 3, 4 years for PhD. Why? So 20 student into 7, 140 student being physiotherapists every year. Till today, 5,000 becoming physiotherapists every year. There's a difference. That means the demand is there. We are wanted. People want. Like I get calls from clinics in Bombay. Ke, Sir, koi physio hoga to bhejo. That means it's needed. And people over the period of time, I remember as students, we were called malishwalas and kasratwalas to knowing us. And thank God, cricket made us so famous. After I joined the Indian cricket team, the word physio started coming and everybody. And some of my seniors still, when they meet me, they say, sir, we did physiotherapy, we only seeing you running on the ground. So when people ask us, what is physiotherapy? We have to just say one line. You see in cricket, somebody gets injured, the guy comes running on the field. He's a physiotherapist, right? And I'm so happy. Every field of sports today has a physiotherapist.
That is really true and justified as a physiotherapist. So
Right.
moving on, you are a face of a very big brand. The brand is now known by you, and you have did 100% justification to the brand as well. So my question to you is, did you feel any criticism for that? Because nowadays, when young physiotherapists who are not at a position like you, when they try to do something beyond the limits, something beyond the curriculum, are always being criticized for the same. They are being criticized, they are being taunted, and not from others, but from someone who's from the same fraternity, their own seniors, their own senior doctors. So I would like to ask you, as Dr. Ali Irani, when you became the face of such a big brand, did you feel any criticism? And on another note, on a personal level, do you really feel that a physiotherapist, a doctor, should not do anything beyond treating patients?
See, professional jealousy is not only in our profession, it's in every profession. So I will tell you a small story.
Yeah.
There was a tender, global tender of sending crabs to USA. So the global tender mein cheapest was Indian crabs. So they asked, how can it be so cheap? Okay, because the packing is costlier than whatever we are talking about. Uh, Packing is costlier. So the team came from USA
Hmm.
to check. So they said, okay, we don't pack, we put it in our drums and they will come to US. He says 28 year on sea, open drum, the crabs will just get down and go to the sea.
Hmm.
They said, no, 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 they are Indian crabs. When one is coming up, four will be pulling it down.
Oh.
So in our profession, definitely, I also went through all this. I wanted to read a paper on sports medicine way back. I'm talking about 1986, right? And I was told, okay, what we have to do with sports, physiotherapists, right? What we have to do with sports. And then after 87, we bloomed and things came up. It was 89, I wanted to speak on disaster management. Okay, it's our role. Physiotherapists should go the first. So again, by seniors, I was told, what is our role? अभी तो doctors जाएंगे, plaster लगाएंगे, 6 week के बाद plaster खुलेगा, then we will go for mobilization. I proved them wrong. It's duty of a physio to reach first. We have so many things we can do and help the doctors on the field. So anything that is new will have criticism. So we had dry needling coming in, there was criticism, acupuncture had criticism, taping had criticism, then the band exercises came, there was criticism. So till it is proved, it takes time. But if we don't, now there would be an association of acupuncturists has already been made. Just because it didn't come in our curriculum, we didn't take it, somebody else will take it. So dry needling, we don't take, somebody will take it.
Take it, yeah.
Right? Manual therapy, osteopathy, because we didn't take it, they have their own association now. So, but I feel whatever heals the patient, we are here to treat the patient. Whatever heals is important, is good.
That is very necessary. And your words that you have gone through the same would have healed so many hearts over here
Yeah.
listening to you. Because I
Yes.
have personally seen a lot of people going through this, and your words would have definitely healed them. Moving
See,
on.
I was told, sorry, I was told by a very senior friend, okay, be like a camel. When camel is going with all the goods on the back, dogs are barking, people throw stone,
Yeah.
but you will never see a camel looking at it till it reaches the destination. And when the camel is offloaded, they say he turns back and grunts. telling the people, see, I have reached my destination.
Yeah,
So all the newcomers whom you feel you are being criticized and all that, please keep doing your work. And I always believe strongly that दुनिया झुकती है झुकाने वाला चाहिए. You keep
that's
doing your good work.
so beautiful. Moving on, sir, I would like to talk about a term that is internship. Now, this is a term that actually thrills people, especially those who have gone through this. So, even you were a student at a time, and nowadays also you would have seen students very closely who are doing their internship, either under you or from any other place, but you would have come across their stories and their own struggles. So, what do you feel, sir, when you were a student, you were doing your internship, or you were in that struggling phase? What are some challenges that you faced at that time, but you feel that nowadays we are lucky, the young physiotherapists are lucky that they do not get to face it?
We, when we were doing internship, we were lucky. All the colleges that had physiotherapy were attached to a medical college,
Yeah.
right? Now, with maybe more than 300 colleges, more than half of them not attached to a medical college. Even the anatomy physiology lectures are taken by a physiotherapist. But we used to go to anatomy lab of a medical college. We used to go to a physiological lab of a college. So definitely a number of patients, especially government hospital like MS University Baroda, SSG Hospital in Baroda, we had only patients and patients. Like so, it's a difference between students doing it from a government college with a lot of patients and people doing it maybe from private universities or private colleges we don't have, which doesn't have a hospital. So that's one. So if you were doing from a government college, we were paid internship. There was a stipend coming to us. Now from private colleges, they pay. The student has to pay to be an intern. Because coming to my hospital, I know we have to teach them every day. There's a lecture every day for 1.5 hours, 1 hour, teaching them everything, how to see patient, how to evaluate, how to use the modalities. So that means it's part of the curriculum. The college didn't teach them, or they didn't have a hospital, they didn't have an ICU, they didn't have an ICCU. We have a night duty, we have a holiday duty. So when our students are being learning here, that means we only make people champion. You come, learn, and
Hmm.
there is a staff above the head teaching them. Cardio, we have a specialist from cardio, specialist from neuro, specialist from sports, specialist from musculoskeletal, specialist from manual therapy. So some of the colleges just want to some say give them NOC, go and do it from anywhere,
Hmm.
right? And again, the student has to pay to go there.
Yeah.
So forget about getting any. So yes, but I think so. Still, there government colleges they pay for as a stipend. Even master students get paid in at least Mumbai. All the municipal and government hospitals they are paid a stipend. So depend from where they are doing and why. When they are in first year, a lot of things. Sometimes it's a 4.5 year course. They finish by 5.5 years. Not their fault. The university declares the result later, so they keep falling back by in a whole term.
Yeah.
So I don't. It's a 4.5 years, but sometimes it's 5.5, 6 years.
Yeah, it does happen. So, yes. So, sir, when you are saying that as a practitioner, as a senior during internship, you yourself teach students, there are lectures in your hospital and many other hospitals. Do you feel that this is the right way when a student does not know anything? In the whole conversation till now, we have seen the lack of knowledge being provided by the university itself at many levels, be it the problem of having a multi-speciality OPD or anything. But do you feel that the doctors over there in the hospital, who are the so-called seniors of the intern, don't you feel that many of them actually forget that even they were at a time of an intern some of their lifetime? Don't you feel that they forget their own time and they try to target a single student? And many of them even complain of mental and physical torture in the name of internship during physiotherapy. So at a position where you are, what are some things that you feel that needs to be rectified over here?
See, one, I feel every year student that I'm seeing every year, I say a year earlier was better than this year. Then again, when I go, so there is a fault with the students also. As the time passes, they are more with their mobiles. They are relying more on the mobile. They are not seeing patient. I've seen interns or staff treating patient with the mobile on, where they are treating and they are replying, they're giving ultrasound and also working on the mobile. So it hurts the patient.
It is.
So yes, definitely from second year that we have the clinics, we are paying money. Your parents are paying fees. Go and learn. Mobile can come after that 8 hour of college or 6 hours of college.
Yeah.
So learning is not only during internship. It is from second year, third year, fourth year. Internship is to make you realize what field you like the most. You have given
Most.
different posting, ortho, neuro, peds, OPD, wherever you are. It should tell you what you loved more. You have the skill of examining and treating the patient, and definitely during internship you can still ask questions to your teachers. Yeah, how explain me this. But after internship, you can't be doing that.
Yeah.
So then it comes, you should have been knowing how you don't know this, how you didn't learn this, you should have learned, you should have done. So I feel internship is a time where there is no tension of exam and you have a right to ask question and see more patients.
Okay. Moving on, sir, I would like to take you to a segment of my show where we have a questionnaire that is Ask the Doctor. We ran a promo of you and we have a set of questions that the general audience has given for you. Let me ask a few of them so that even they feel answer. So we have our first question from Mr. Ashutosh Pandey from Delhi. He says, "Hello sir, how are you? Licensing body is charging so much. 5,000 से भी ज़्यादा charge करते हैं. How can a student like me afford this? मैं डॉक्टर कैसे बनूंगा अगर अभी से इतना exploitation होगा? क्या ये सही बात है?"
It's not an exploitation. You know driving, but you have to go and take a license for it. So you'll pay there, right? So when you want to become a become a member of Indian Association of Physiotherapy, or some of our states have a council. Delhi has an OTPT council, Maharashtra has an OTPT council, Gujarat has a physiotherapy council. They all charge, and it's one lifetime.
Hmm.
You pay once, and then once in 2 3 years, if they are asking you a minimal amount, it's part and parcel. We should not be calling it it is costly. Go and check your fees, how much you paid.
Hmm.
The fees of a private college is costly, where they charge you a lakh of rupees,
Yeah.
right? So licensing body are not charging you something for the lifetime membership. So it's a wrong
So, sir, when
question.
it comes to licensing body, don't you feel that the state councils for physiotherapy and the national council, or all of them altogether, do not have a particular coordination between them? One law that is applicable over there in Maharashtra is not at all acceptable in Delhi or in Haryana or in Gujarat. Why do you feel so this occurs?
It's all over the world. If I'm a council member of Gujarat, I'm allowed to practice in Gujarat.
Yeah.
Yes. If I'm a member of Maharashtra, I'm allowed to practice in Maharashtra. It's not that I can't practice at other places. Then it becomes when I'm putting up my clinic. I have a Gujarat council membership, but I want to put a clinic in Maharashtra. So I will go and ask the same body and tell them, okay, I already have a council. So the process becomes easier. And before the council, we had the IAP, Indian Association of Physiotherapy, which is a life membership. So wherever in the world you want to go and settle, they will be wanting a letter from IAP, good standing letter. So that country also accepts you. 127 countries are member of IAP.
Great.
Yes.
Moving
And
on.
IAP
Yeah.
is under World Physiotherapy, and World Physiotherapy is under WHO, World Health Organization.
Yeah.
That's how we go step by step.
Yes. Moving on, we have a question from Kiran Shukla from Muradabad. सर आप कैसे हैं? आप जैसा बनने के लिए हमें क्या करना पड़ेगा? मैं एक लड़की हूं, क्या मुझे आपकी ही तरह इस फील्ड में चांसेस मिल पाएंगे? आई एम अ थर्ड ईयर फिजियोथेरेपी स्टूडेंट.
जरूर, जो मेहनत करोगे तो क्यों नहीं मिलेगा. हर चीज, हर मेहनत के पीछे कुछ होता है. तो मैं भी कुछ, मेरे भी मम्मी डैडी डॉक्टर नहीं थे. मैं भी स्कूल के बाद 6 स्टैंडर्ड से घर पे जाके होमवर्क करता था, फिर आके 4 बजे से रात को 11 बजे तक काम करता था. राइट. आप नानावटी हॉस्पिटल में आओ, जहाँ मैं अभी हेड ऑफ द डिपार्टमेंट हूँ. वहाँ एक रेस्टोरेंट है, और रेस्टोरेंट में मैं काम करता था। right?
Oh,
तो लोग मेरे को वैसे पहचानते। अभी भी 4 लोग हैं जो कैंटीन में काम करते हैं। मैं महीने में एक बार जाके उन लोग के साथ खाना खाता हूँ। हम लोग साथ में खाना खाते हैं और पुराने दिन याद करने के लिए। तो प्लीज मैं वापस करूँ कहूंगा आपको कि दुनिया झुकती है, झुकाने वाला चाहिए। मेरा भी पगार जब भी मैंने फिनिश किया था फिजियोथेरेपी, मेरा भी पगार 600 रुपया था महीने का, 600 रुपीज पर मंथ।
this is so inspiring in its own way. The last question is from Himanshu Choksi, who's from Jaipur. He says, internship के टाइम पर हम जो मेंटल और फिजिकल टॉर्चर सहते हैं उसकी कंप्लेंट किससे और कैसे करें? हम लोग इसलिए नहीं कर पाते क्योंकि हमें डर लगता है कि हमें निकाल देंगे. हाउ डू वी हैंडल दिस सिचुएशन सर? प्लीज हेल्प मी एंड गाइड.
एक कंट्री में कुछ लॉज है, अगर आपको सताया गया, आईएपी में ग्रीवियंस सेल है, आप ईमेल भेज सकते हो, तो आपका नाम कहा नहीं जाएगा। राइट। और आप आईएपी में है, काउंसिल में है, ग्रीवियंस सेल्स है, फिर हमारे पास पुलिस स्टेशन है। right? तो काफी चीज होता है जो आजकल तो सोशल मीडिया इतना स्ट्रांग है। और ऐसा हुआ है, हमारे काफी सीनियर फिजियोथेरेपिस्ट लोग प्रॉब्लम में आए हैं जहाँ स्टूडेंट ने कंप्लेन किया है और वो यूनिवर्सिटी को, टीचर को निकालना पड़ा। तो ऐसा नहीं होता है। मैं आपका बात को मानता हूं, होता है, पर उसका भी रास्ता है। आपको क्या कर सकते हैं? अगर अगर आपको ऐसा लगता है कि आपको फेल किया जाएगा, ऐसा नहीं होता है। एग्जाम यूनिवर्सिटी लेता है, तो एक टीचर के हाथ में नहीं होता है। और हर टीचर के ऊपर कुछ डायरेक्टर होता है, डायरेक्टर के ऊपर चेयरमैन होता है, वाइस चेयरमैन होता है। एक ट्रस्ट है, हर इंस्टीट्यूट एक ट्रस्ट है। तो आप पहुंच जा सकते हो। और अकेला मत जाओ, 3-4 स्टूडेंट्स को साथ में ले जाओ। जब साथ में जाओगे तो जरूर। और कभी ऐसा आपको लगेगा कोई भी आपका नहीं सुनता है, तो प्लीज मुझे ईमेल करिए, मुझे मैसेज भेजिए, मैं बात करूंगा उन लोग से।
This is great. So moving on, whoever has met you or whoever wants to meet you would agree to one fact that you always give a blessing of healing hands, of having healing hands. But my question over here is how actually one gets healing hands? What does it takes to have the healing hands?
Yes, I do tell all the physiotherapists, कि may God give you a healing hand, because the degree will not do after some time. Till today, after having 2 PhD, almost completing my third PhD, nobody has asked me which university I have studied. Nobody has asked me what is my degree. I'm BPT, MPT, or PhD. Nobody asks all that. They see your skill, right? So, if you grow a mango tree, you cannot get coconut from it. If you sow rice, you cannot reap wheat. This we call something like karma. Be good, be nice to your patients, smile at everybody, help everybody, and it comes back to you. So if you have 10,000 rupees in your bank account, 10,000, can you give a check of 11,000?
No.
It will bounce back. Similarly, so I would say, all those who are failing, my mantra would be stop gossiping. Gossiping takes away your energy,
Yeah.
and try it for 40 days. Your life will change. Stop gossiping. Don't talk about others behind the person's back,
Hmm.
and life changes.
It does for the best.
Yes.
Sir, people look upon you as their source of inspiration, especially in the field of physiotherapy. One wants to become like you. But whom does Dr. Ali Irani looks upon to? Who is your inspiration?
Dr. Rambhai Patel. As my principal of college, it was Goel sir in Baroda, Padole sir. Coming to Mumbai, it was Dr. Rambhai Patel, Bombay Hospital. God bless his soul, he's no more there. But he taught me a lot. And similarly, I've got 824 students in USA who have finished from Nanavati, and they are there. It's my 37 years in Nanavati. We have interns, we have got MPT students, and I've got PhD students. I've maybe at least 200 in UK, maybe at least 200 in Canada, maybe 100 in Australia, and all over the country. Those have finished either internship with me or MPT with me or PhD. So they are spread all over.
In a way, Dr. Ali Rani ji is all over the world. We can say so.
Thank you. It's God has been kind.
Yeah. Sir, you have met a lot of Bollywood professionals, Bollywood actors. You have treated them, you have helped them regain their strength, energy. So, what was the most interesting encounter of yours? Would you like to share any of the encounter with a Bollywood celebrity with us?
See, when I started treating them, I see them as a patient.
Good.
So the time you start seeing them as a celebrity, then you are not doing justice, and they realize.
Hmm.
But the way when you treat them as a patient, not bothered, not clicking photographs, not being bothered about it, what you are doing, so they realize that they have come to a physio and they have got the right treatment. So that excitement, what some of the physios show or do, uh, it doesn't go a long way. Maybe I went a long way. I was not bothered.
A
Treated almost
patient
all
should
of
be
them.
patient.
Treated all of them, but never bothered.
Sir, in a very famous Hindi cinema, which I would not like to name, but everyone knows what cinema I'm talking about, where there is all about a medical student and medical school. The professor says, it is a very old movie. The professor says कि body को body समझो, उससे relation या उससे emotions मत रखो. Only then you can treat a patient. So, do you agree with this, or you have
I,
any other stand on this?
I said it another way. That's all.
Yeah.
Yeah, same. You have to treat them as a patient.
Sir, we have a lot of colleges and universities in our country, but and also, yeah, we have seen a lot of students enrolling nowadays in physiotherapy, especially after our Prime Minister Narendra Modi talked about it. Physiotherapy has really gained the position it actually holds, it actually deserves. But at the same time, we have teachers, we have professors in the universities that are not up to the mark. Either they do not know fully about a particular point. Don't you feel that there should be a regulation of the teachers as well, of the professors as well? Because at the end, it is the students who suffer because of this. When they apply over there, when they apply over any other place, they feel how much they have been lacked because of the lack of knowledge of teacher.
See, one, every college has to go apply for the recognition through IAP.
Yeah.
So I have been to many colleges as an inspector earlier, maybe till 5 years back. So our duty becomes to check the teacher's qualification. We check the classrooms. We see the education of the teachers who are going to teach, how many years experience, whether they are only graduate or postgraduate. So I feel just wait for a few more months. We have a national council at place.
Okay.
And Dr. Yagna Shukla is the chairman, who is a physiotherapist from Civil Hospital, Ahmedabad, Gujarat.
Yeah.
She was She's also a student from my university, 1 year junior to me. She's taken over as the chairman, and I'm sure it will be put in together. So all the colleges which are existing, we don't know how many will qualify or how many will would be able to come to the level that whatever the council wants. So job of a council is to see the regulation, whether the right teachers are teaching, whether the right atmosphere is there, classes are there, and how the students were selected, okay, and who takes the exam, the examination body. So all this will be put to place. So it's not, I still feel it's not too late. Very soon, hopefully by end of this year, our national council will work. So tomorrow, even you can be just member of one council. That's where it will come. Kevin, if you have a driving license, you can drive anywhere in the country. If the currency, a 500 rupees note, you take anywhere in India, you can use it. So similarly, maybe once you become the national council member, you will be able to practice anywhere in the country.
Very
Just
well
patience.
answered. Very well answered. So, as we move to the end of the segment, to the end of the show, what will be your message to everyone listening to us, be it the students or the teachers or the doctors?
Be nice to your patient, be kind to your patient. Don't be rude to them. They have come to you with a problem. So you be nice to them. explain them. I prefer explaining the problem to the patient. Okay, what are the options? This is your problem. I can do this, I can do this, or you can go for a surgery. You can take another opinion of a surgeon if required,
Yeah.
or an expert.
Well, with this, we have come to an end of the show. I would like to thank you, Dr. Ali ji, for coming to the show once again and enlightening us with your wise words. I am very sure that your words would have healed so many of them listening to you. Thank you so much once again.
Once again, may God give you all a healing hand. God bless you all. And thank you. You are lovely as ever.